Are you too young or too old to have cosmetic surgery? Well, let's take a deep dive in this episode of Rohrich Knose Best. So welcome back to Rohrich Knose Best. Today we're going to talk about cosmetic surgery and timing. Is it really age-related? And so what is the right time to have facial rejuvenation or any type of cosmetic rejuvenation? Well, let's look at the general trends. And obviously, we know that in the 20s and 30s, we do prejuvenation, Botox, skincare, lasers, and fillers occasionally. But then the optimal rejuvenation window is 40 to 60, and then 70s is still a good time if you're in good health. But what are the exceptions? When is it too young or too old to do this? So let's take a look at that. And teenage plastic surgery, now that's a hot topic because in general, cosmetic surgery in teenagers really has been frowned upon, except there are some exceptions. And one of the biggest exceptions is an otoplasty. And, you know, prominent ears are some things that people get teased about all the time. And so these are the types of patients that look amazing after doing otoplasty at a young age 5 to 6, because it's been transformational, because kids are cruel to each other. And now they're cruel to each other on social media. So doing an otoplasty on patients is transformational. And I do that at age 5 to 6. And it's amazing how it transforms these young boys and girls. It's just unbelievable when they come back in 2-3 months, especially if they do it in the summer and they go back to school, they no longer get teased. And the same with rhinoplasty. Rhinoplasty in a young girl, age 14 or 15, is totally fine and appropriate if they're otherwise psychologically mature, and I do that all the time. And in young boys, 15 to 16, a little bit later because males tend to age a little bit later. So it's a very powerful technique to do. And these are the patients that are totally transformed. And you can see that on my Instagram when I talk about teenage rhinoplasty. These patients are unbelievable. They come back, they look, feel better at 1, 2, 3 months, and it's just transformational. So really, this is when it's indicated. It's phenomenal. And likewise, I've talked about this before in other podcasts where we talk about not only rhinoplasty, but also teenage rhinoplasty. Now, a little bit more of a delicate procedure is, of course, breast augmentation. I mean, in general, age 18, and then you can, in the US, you can use saline implants until age 22. No big scientific reason or rationale, that's just what the FDA recommends. But breast augmentation in that age group is in a patient that's psychologically mature, is fine to do. And obviously, I think it's something that is very worthwhile. And then, of course, in some patients that have significant breast asymmetries or deformities, then you can do them at a younger age. And certainly, that's appropriate to do. That's in the breast reconstruction type of realm. So let's go from the young age to the old, quote unquote, after teenage. And so when is the best age to do plastic surgery? Now, you've noticed the trend recently, especially in social media, people doing their facelifts in their 40s and late 30s. I think that's a little early, but in their 40s and 50s, honestly, is probably an optimal time, especially when you start seeing jowling and you don't want to keep filling because filling looks terrible. When you start seeing jowling, facial rejuvenation is very important and very powerful. And it lasts a long time. A facelift done at a younger age looks better and lasts longer, bar none. Or you can do it in a patient that's in their 60s and then look at her 11 years later. She looks amazing because she's kept taking good care of herself. So facial rejuvenation is age appropriate, depending on not on the age, but on the health care of the patient. And this patient is very healthy. And certainly, same thing with doing nasal reconstruction or rhinoplasty in the patients. It's very powerful to do that. In a patient like this that had a significant nasal deformity, that had multiple previous rhinoplasties, and she just wanted to not only breathe, but look better. So that's very powerful to do in those patients. So in the aging patient, rhinoplasty is certainly very appropriate to do because as we age, our nose droops, Our skin droops just like everything else. Our lip gets long. Our earlobes get long. So you can do a facial rejuvenation in somebody who's rhinoplasty in somebody who's young, like the lady on the left, or somebody who's much older. And rhinoplasty is both functional and aesthetically part of facial rejuvenation. So, and as I mentioned, as we age, our lips get longer, our noses get longer, and they droop. So it's only appropriate, and I do a lot of rhinoplasties with facelifts, because it makes the face and nose and eyes all match and look appropriate. So anatomic aging occurs not only in the face, but it occurs in the nose as well. And I think that's very important to understand, and certainly something you can address. And especially if you're if a rhinoplasty and facelift expert, you should be able to do both at the same time. And I think that's very, very powerful to do, as you can see in this patient, where she had both facial rejuvenation and a rhinoplasty. It softens their face. It really makes them look much more natural. And then in the youthful, younger patient, in their 40s, I think something is rejuvenative that looks so much better in a patient that doesn't want any more fillers, just wants to look youthful and rejuvenated. Here she is at 15 months after her facial rejuvenation, a deeper layer facelift. I think that's so critical. So you can actually do patients that are in the spectrum of the 30s and 40s and in their 60s and 70s if they're healthy. So I think the power of facial rejuvenation spans the life of the patient. And it really depends upon where they are in their life cycle. If they want to do it at a younger age, that's totally appropriate, because actually facelifts done at a young age actually look better, last longer, but both are fine as long as they're done in the hands of a board-certified plastic surgeon that understands the aging process, because a facelift done in the 40s is completely different than one that's done in the 50s, 60s, and 70s, because their needs are different and their aging is different. Because in the end, you want someone to be invisibly visible but beautiful, like this patient. She's beautiful, and she looks 20 years younger because she's had facial rejuvenation, central facial fat augmentation, and eyelid surgery, all of it to make her look more youthful and look natural. And I think that's really the key to it. So you're never too young or too old to be ready to have aesthetic surgery if you're healthy and you're in the hands of a skilled plastic surgeon that gives you realistic outcomes, and obviously the most important thing is to have a safe outcome. So know before you go, choose wisely. Give me your thoughts, give me your comments on aging and plastic surgery, and until next time, stay safe and stay informed.